Welcome back to another video. In this video, we will talk about 3 important things to consider before starting metacognitive therapy. But to be honest, I also think that these apply to starting all kinds of other things, including other types of therapy, like for example, CBT or ACT. I think many of us, prior to starting a new therapy or a new course or studying something new, would have doubts about whether we are ready, whether there are some things we have missed, whether we've done our research well enough before starting. So in this video, we're going to look into 3 important considerations prior to starting metacognitive therapy. So the first important thing to consider is, am I willing to commit for the next couple of months or half a year to this approach? And that means, am I ready to show up for sessions or show up virtually for sessions? Am I willing to put in the work that is required of me? I have clients who tell me that, you know what, I would love to start MCT, but right now I have some deadlines that are very, very important that I need to meet. I'm in this process of graduating, so there are a lot of things going on and I can't fully commit to therapy. Would it be okay if we wait? And I really respect that because it shows that you are willing to commit and you're setting realistic standards to when you are ready to do so. It's kind of like if we compare that to going on a diet. If you have decided to go on a cleanse or a diet, knowing also that in the next coming month where your diet starts, you are invited to a lot of parties where you will be eating a lot of cakes and unhealthy foods and drinking alcohol. Those 2 things may not align very well. And you probably wouldn't start your diet until you have attended those parties and invitations before you are ready to commit to your diet. So the same thing goes for starting therapy. Therapy does require that you do focus on the process. One thing is to be present in the sessions with your therapist. Another is to also make sure that you focus on the things that you've learned and also practice them, which is my next point. So the second consideration is, am I committed to do the homework that is required of me so that I can improve and I can feel better? This point is so incredibly important, and yet many of us tend to overlook it sometimes. So I've had clients telling me that, you know what, I don't think this therapy is helpful for me. I don't think this is working. And I do make a big deal out of asking my clients whether they have been practicing, how they've been practicing, and how much. I really make an effort to make sure that I understand what's been going on between our sessions. And it's very surprising, but these clients tell me that they actually haven't practiced enough or they haven't practiced at all. So it may be an obvious point, but not practicing, not doing the homework is not going to help you improve. And we do know that most of the progress happens outside of the sessions. I have sessions with my clients for 55 minutes, once a week, once every 2 weeks. That's not going to be enough for them to notice an improvement or for that to have an impact in itself. What needs to happen is the amount of work that they put in on applying the new strategies we talk about so that they can really feel what it is like to be able to reduce worrying, to reduce rumination, to be able to cope with difficult feelings and in difficult situations outside of therapy without the therapist being present. So that is what builds the psychological confidence, if you can call it that I am able to apply these new strategies and improve based on those. So the homework is incredibly important. Again, this does not only apply to metacognitive therapy, it applies to all other types of therapies that are homework based. So the third important consideration to have before starting metacognitive therapy is to choose only one method at a time. Suffering from mental illness, from anxiety, from depression, from OCD is incredibly debilitating. It's painful, it's tiring, it's draining, it can make you feel hopeless. So it makes sense that you want to improve very, very fast. I completely get that. However, some of you might think that if I did more things, then I would improve faster. I would get better more quickly. If I learned both mindfulness and meditation and I did ACT therapy and I did MCT, then I would have all these tools in my toolbox so that I can help myself and improve. So I really respect the value behind wanting to improve and wanting to take matters into your own hands. However, doing more is not necessarily always better, at least not at the same time. So in MCT, we say to our clients that only to choose one treatment at a time. So if you're doing MCT, you should not at the same time also do a meditation course or do some psychodynamic therapy or something else. So I'm not saying you should only choose MCT above other things. I'm saying that you should only do one thing at a time, whether it is CBT, whether it is ACT, whether it is meditation or MCT. Only choose one modality and really commit to that for a certain period of time. If you're committing to many things at once, you're not going to be able to focus very well on one thing and be fully present and apply the things that you learn very well. It's only going to make you feel more confused, and it's going to be a waste of time, and you're going to feel a little burned out and maybe disappointed at the end. So I recommend to only choose one modality. I have one more recommendation that I just thought of, which I think is important, and that is to not shift between modalities all the time. I've had a client who would have doubts about whether she was in the right treatment. And every 2 weeks or so, she would shift to something else and then come back to doing MCT. So the next time she shifted and then wrote me back because she was considering to coming back to MCT, I encouraged her to not do that and stay with the other treatment for at least 3 months before she decided whether this was going to help her or not. The thing is, if you shift back and forth between treatments, you're not going to fully apply the things that you learn, and you're not giving yourself enough time to really test it out whether this is working for you. If you shift every couple of weeks or every month, you're just cheating yourself of a helpful treatment that would have worked well for you if you've just done it more and for a longer period of time. So try not to shift back and forth between treatments unless there's an obvious reason for that. So just because you have doubts about whether something is working for you, it doesn't mean you should trust that doubt. What you can trust instead is, okay, I've committed to this treatment for at least 2 or 3 months. I did the homework that my therapist and I agreed upon, and I did everything in my power to make sure that I made this work for me. And by the end of that, if you're still thinking, this really didn't help, I haven't improved from my anxiety, depression, OCD, then it makes sense to stop that treatment, and that is a good reason to start something new, to start a new treatment approach. However, shifting back and forth because of doubts is not. Thanks for watching.